women's hormonal health doctor, and I've partnered with Thinx to talk about something not a lot of people are talking about: menopause. So, first of all, what is menopause? It's the natural decline in our reproductive hormones as we approach our late 40s and 50s. As we age, so do our eggs. And once our egg reserve is diminished, we stop ovulating. And without ovulation, we don't get the same fluctuation of hormones that we do during our reproductive years with our menstrual cycles. And the diminishing of our hormones, in particular estrogen, can cause those classic symptoms that we see in menopause, like low libido, hair loss, drier, itchy skin, looser skin, drier vaginal tissue, weaker muscles. And that, for some people, can also lead to incontinence. I'm going to show you a few ways that you can support your body and your hormones during this transition so you don't have to deal with those debilitating symptoms anymore. So let's start with our liver health. Our liver is what processes everything in our entire body: what we breathe, what we drink, what we eat, what we smell, what we put on our skin. Everything goes through the liver first. Hormones are just another thing that your liver is processing and metabolizing. So supporting your liver health can make a huge difference for your overall hormonal health and that transition through menopause. So if you have symptoms of irritability, you're waking up at night, particularly around that 2 to 4 a.m. time, or you have breast tenderness or hot flashes, night sweats, these might be a big sign that your liver is asking for a little bit more support. But I do want you to remember these symptoms could also be related to other health issues, and this video is purely educational. So if you are noticing any of these symptoms, make sure to consult with your doctor. So I want you to focus on these 3 pieces: pooping every day, drinking lots of water and getting your urine hydrated, and I want you to sweat for at least 20 minutes every single day. And I don't mean those nervous anxiety sweats. I want real intentional sweating that gets your heart rate up and gets you sweating so that you can get rid of everything your liver is processing. And now, the second thing I want you to know about aging gracefully and moving through menopause is about your adrenal glands. Your adrenal glands are these tiny little glands that sit right above your kidneys, and they're mostly known for our cortisol regulation. But what you might not know is that around menopause, when our ovaries stop producing that estrogen, our adrenal glands are still producing a small amount, like 2% of our estrogen. So if we can support our adrenal glands throughout this process, we are going to see a much better time here. I want you to start with one simple thing: a healthy bedtime routine. A healthy bedtime routine is going to consist of winding down your nervous system and relaxing into sleep instead of just falling asleep from exhaustion. And if you're like, what does that mean? Then I'm going to ask you a few questions, because right now, if you are falling asleep watching a show or a movie while you're in bed, and then you switch to scrolling on your phone until your eyes can't stay open anymore, that is super stimulating for your brain and your nervous system. So does that sound like what you're doing? Because right now you're falling asleep because you just can't stay awake anymore. And this is going to give you a poor night of sleep. You're going to be waking up a lot. You're going to be tossing and turning. You're going to result in waking up feeling so exhausted. You're going to hit snooze 100 times and then drag yourself out of bed looking for that cup of coffee. Instead, I want you to focus on giving yourself at least 30 minutes without any screens before bed. Do whatever you want to do in that time that doesn't involve bright lights or overhead lighting. Listen to music, read a book, do a puzzle, drink some tea, sit outside, whatever it is that you enjoy doing that is not stimulating and it is in low light. And when you're done, do not get back on a screen. Do not check your phone. Do not pass go. Just go to sleep. And you're going to notice that you're sleeping so much better. You have more energy. You feel more rested over time. So, how are you feeling? Do you feel like you can age gracefully into menopause? Do you feel like there's hope that you don't have to have all those symptoms that we're so often seeing? Because focusing on your liver health and your adrenal health are 2 just simple things that can make a world of difference for you and your hormones.